Sensationally silver, because you are.
Welcome, everyone, to Sensationally Silver, A State of Mind, conversations with extraordinary, ordinary persons of age, people who are going to bring you information, inspiration, and validation. Join us. Hello, everyone. Welcome to Sensationally Silver, A State of Mind, conversations with extraordinary, ordinary persons of age. My guest today is Soffhea Gervais, and she is a chiropractor, but she's more than that. And I'm going to let her explain what that means. Go, Soffhea.
Hi. I guess it all started when I was about 21 and I just became fascinated with health and healing. And one step led to another, and eventually I ended up with a chiropractic degree. But I didn't stop there. I found problems that people had that led me to the next thing and the next thing. So eventually, I think most people that have been in the healing profession want to keep adding and adding until they can solve more of the problems that they see on a daily basis. I think one of the things that I love about integrative health is that we actually partner with our clients in their journey to feeling better. And I think that's a really exciting approach.
So, Soffhea, when you were first starting out, and I imagine this has happened all the way along, you probably encountered patients who had some things going on, and you thought, this is a different basis than just physical. Can you give an example or tell some stories about
Oh,
what
yeah.
prompted you to widen that base that you were operating from?
Yeah, I actually did start off just being fascinated with the healing capabilities of massage and emotional release through the body. But then later, I started learning the emotional connection with a technique called neuroemotional technique. And it involved muscle testing to access information, because everything in our lives either strengthens us or weakens us. Every thought, the foods we eat, the people we spend time with, are either enhancing us or taking away from our vitality. So through muscle testing, you can access pretty much anything, whether it be nutritional deficiencies or emotional blockages. It's actually called applied kinesiology, using the muscles to locate levels of dysfunction in, say, the spinal area. So it's it's just one of the many techniques that are used to see the whole person.
You know what you said about, I mean, I imagine anybody who's watching or listening is kind of going sideways and thinking about, how do these things that are part of my life affect me? When you say everything either weakens us or strengthens us, makes us
Mhm.
makes us more whole, more solid, more true to ourselves, or to some degree, my word, not yours, incapacitates us for life. That is such an important thought. I don't go around thinking that all the time, but it makes total sense to me.
You know, it is so funny. I mean, I have a lot of thoughts about different people that I've known over the years. And I had one person who came, she was not holding her correction. She'd been in a car accident, and she said, I'm so frustrated because I just keep going back to being out of alignment and having these discomforts. So I did muscle testing, which is where you actually just push down on the arm. And um, I had her bring in, I found that it was a food related thing. So I had her bring in things in paper bags, and I tested. And when I opened the bag, it was chocolate. And I said, the thing that seems to be affecting your structure is chocolate. How much do you eat? She said, about a pound a week. And I was like, wow. She's very thin and then I said, all right, I know you have a real attachment to this eating chocolate, but would you be willing just to go off of it for 10 days? And she did. And when she came back, she said, I feel completely different. So, that was something she loved. It could be anything for anybody. It could be wheat or dairy or something like that. It could also be an environmental thing or, a repetitive thought that affects people.
It sounds like it could also be a person from what you were saying. Have you
Yes,
explored that with patients?
I have. Sitting in an office job or something like that with maybe a supervisor or somebody who just creates a lot of toxic negativity will definitely make people's back, neck, and shoulders and so forth have symptoms. So it is, when we do think about that, we can be more empowered to look at our environment.
Well, we have language that describes these kinds of things. We say, oh, he's such a pain in the neck. Or, I feel
Yeah.
like I'm just carrying this person or whatever. We without even thinking about too much about what that means, we're doing it and we're describing it.
Yes,
Makes my
absolutely.
stomach go into a knot or whatever. The body's kind of yelling at us. This isn't good for you.
Yeah. And in that way, we have so many of those languages like, that disgusts me. Well, that is the stomach. And a lot of times people go through events. I will use, muscle testing. Sometimes people say, I have this recurrent thing. It could be a pain or a problem. And you can scan the body and find what the emotional relationship is there and then work to clear that. And there's so many great things out there, whether it's therapy or EMDR or any of that.
Okay, so lots of paths to getting well. What happens when you encounter someone who's suffering, complaining, needs your help, but isn't willing, like the woman with chocolate? I mean, I used to do a class on understanding addiction, and I would tell the class, if you want to know what you're allergic to, just think about what you crave. And there was someone in the class, I'll never forget this. She raised her hand and she said, let's face it, we don't drive around at night looking for broccoli. And we don't, I haven't encountered anybody who does that yet. Cookies, cake, chocolate, whatever, often sugar, whatever else, sometimes corn, but very frequently the thing that we are kind of allergic, addicted to, and that's true of alcoholism as well, is the thing our body can't handle, can't metabolize it. It becomes a poison in our system. So what if it's something you ingest, or what if it's a person? Do you have ways of helping people get through that?
Um, that is, well, for example, with this woman in the bag of chocolate, I didn't want to know what it was, and I didn't want her to know, which gives more validity to it. But you're exactly right. We do crave the things that are sometimes undermining us. And when a person becomes aware of that thought process or that relationship, that empowers them to then look for, a solution. Um, and it can be even past memories that people ruminate and try to work over and over and over, but they're not getting anywhere. And, through that, we can muscle test and just demonstrate um, a self-loving thought, a toxic relationship, and see what strengthens and weakens. It's kind of undeniable. I don't even have to know what it is. I don't want to put my input into it. They can just think the silent thought. I will tell you that one time I had somebody who was in a toxic relationship, and they came to my office, the boyfriend and girlfriend, And what was interesting was that I was muscle testing, and it said that he had a reversed emotion. And so just to cut to the chase, I had her across the room. I whispered to her, I said, I want you just to think loving thoughts for him. And then I went across the room and I told her, okay, like think it now. And I tested him and his arm went weak. I went back over to her and I said, now I want you to think negative thoughts about him. Went back and he was strong. He grew up in a toxic family and his mother had been very critical of him. So his wiring had been switched. He actually was weakened by loving thoughts, and it was affecting his relationship for decades. So we worked on that, and it changed their dynamic. They called me a week later and said, we are having a completely different experience of each other. So, that was quite miraculous to help them get back on track and realize patterns that were really unconscious.
That's not something you'd figure out by yourself, I don't think. If someone's responses are exactly the opposite of what would be the most likely or the most normal, I don't know that you can get there on your own. That's really lovely that you were able to help them discover that.
It was, and it was, I never know what's going to happen. I'm not really in control. I'm just the conduit to access the information, whether it's, weak muscle, or in that case, there was he had a broken heart there. And I think a lot of people we have broken hearts along the way, but we were able to catch that one and help him receive the fulfillment that he really wanted.
Can you talk more, Soffhea, about how that changed? Here's this pattern that's been going on since he was a child. And I mean, it's got to be really habitual, that response.
Yeah, he was in his 50s.
In his 50s.
Mm-hmm.
Okay.
Yeah, so they were both really aware people, and they discussed it and really talked about the moments when what he actually began to feel. He became aware that when she was loving and kind to him, he turned off, like some little switch flipped and he kind of went cold within himself. And so they really, really worked on it, and as a loving couple would, and it made a big difference.
So both partners were open to this, were very willing to try to work it through, probably brought a lot of patience to the situation to get through it and to the other side.
Yeah.
Not something you just change. Oh, I won't do that anymore. Not quite that simple.
The muscle testing demonstrates it, where if we were just having a conversation and I said, you might be doing this, but it was just undeniable. And then we showed him with her actually thinking the loving thought, and not actually, she was thinking it and told him, this is what I was just thinking. So, and I've done a lot of other kinds of work like that with people, and it's always rewarding.
Tell us another story, because that's really fascinating. I want to hear more.
Oh, boy. I had some really, some people who'd been abused in childhood, and they had sort of dreams, but kind of like amnesia in a way. But their lives would come forth, the past, the childhood, in dreams. And I was able to use muscle testing and put together whole periods of their lives. This one particular person ended up, now I don't think they do this anymore, but in California they used sodium pentothal, and it's a truth serum, and then put her into kind of a relaxed state. And she came back to my office and just said, everything you said was true. And then in therapy, she was able to really get through some of the PTSD that she experienced. But, it was like all hidden under, um, an illusion about her childhood. And I worked with a lot of people like that. And I'm not a therapist, but I actually would not have done that muscle testing if the therapist hadn't said, let's, let's work together to help this person. And I did not take on any of the responsibility of their psychology, but the therapist did take that and start really working. We did a lot of great work.
It's interesting that the muscle testing, it's almost like a lie detector. And the word lie sounds so negative, but if we think about it as maybe the lies we tell ourselves or the places we just won't go and look at things clearly, or we're not able to look at them clearly. And then here's this demonstration that this is an area where things aren't as they seem or whatever. You've got that proof, just like the food in the paper bag. I love that.
Yeah, yeah. I had somebody else who their skin would break out. And I said, well, let me test and see what that is. And so I muscle tested and I said, it's wheat. And they said, absolutely not. I have toast for breakfast. I have a flour tortilla for lunch. And I usually have a big plate of pasta for dinner. I've eaten like this for years. And I said, okay, well, why don't you just try for 1 week, no wheat at all? And that means no grape nuts. Like, you really have to look at the labels. Well, about 3 days later, I got a call and they said, absolutely, you are right. It changed my life and really improved their health, you know. So like you said, the things we're addicted to, the things we crave actually often are the problem. But it's been so fun just to kind of turn the light on to things for people. And then they are empowered to make the changes themselves.
Yeah. And kind of pat themselves on the back that they are
Yeah.
able to change their life through letting go of something that maybe was really central to their diet or whatever,
Mhm.
but that needs to be left behind. I think brain fog is often a result of food allergies, taking something in that the body can't handle. And people can think they're losing their mental capacity when it's really just this allergy stirring things up and making the person vague and forgetful and all that sort of thing. Because if we have an allergy to it, it's a poison in our system.
Yeah.
Our particular body can't handle that.
Yeah. It's really exciting. And I just think with integrative medicine, with functional medicine, using, herbs and natural things. And I think the muscle testing is really helpful. Of course, it's as good as the tester. If somebody isn't, really able to detach themselves from the outcome of that, they may be affecting the answer. But it's just another tool amidst, gosh, so many things now that are out there. Like there's, the visceral manipulation where you actually gently encourage the organs back into the movement that they naturally have. Myofascial release, where you're actually getting the muscles to track in the proper directions. Um, using the muscle testing to see why is that muscle weak, and then being able to retest and fix that. I just think there's so many wonderful things that, science has done the hard work. The medical profession has the money to test things, has given us the gift of really understanding anatomy and function. But then these holistic practitioners have their own brilliance to, really help people integrate life.
In my experience, sometimes the medical profession or members of it have been the most resistant to the kinds of things that you're describing, this sort of woo-woo approach to getting better. Have you had any occasions where someone who was pretty anti, not wanting to look there, thinking it's silly or frivolous or whatever, they've been converted. Do you have any stories about that kind of thing?
Sometimes, like I recently had a patient who said, I want to go to this functional medicine person who is an MD, but would you come and test to see what products would work best for me? You go to the health food store, you can even go online and order top products um, that have great reputations, but is that really going to work for that person? And it's really nice when you can muscle test and say, these two products don't work, but this one is really good. Sometimes it's an additive, or it was just that it has something else in it. It's a mix and it's not working, or you need a certain kind of calcium. So I've actually had people in that profession say, this is really powerful. And so, otherwise people do spend a lot of money on things that may not really be, just like eating pasta and wheat and tortillas, thinking this is good food for me, you know.
But not for that body.
Not for that body. Yeah, at that time, even.
Yeah. Wow. So do you have a favorite way of, I want to say operating, which sounds a little odd, but what's your favorite technique to use besides the muscle testing, which is obviously so valuable diagnostically? Is there a favorite thing that you just think, oh, goody, I get to do such and such with this person?
Yeah, I have really I have fallen in love with craniosacral therapy. It was developed really long ago, turn of the 1900s, with some brilliant osteopaths that began to understand that the cranium was not one fused bone with a movable jaw, but that actually these bones affected people emotionally, um, their health. And I just feel that it almost feels like a expansive, life affirming experience to get people's cranial system working, and just restore that level of well-being.
How does it go wrong? I don't, that probably isn't the right question to ask.
Oh,
The right question.
sometimes people get an injury. Somebody says, "Oh, a box hit my head," or um, they got maybe they were exposed to a toxin or they got sick, and after that they just didn't feel right, or they had I had somebody that had a skin cancer removed, and then she was having headaches about a year later. So that um, was, because when they did the surgery, they had to pull the tissue in a certain way. Um, I had somebody that had cataract surgery, and the eye didn't focus quite as well. So you can actually do even synchronizing the eyes. So it's really restorative. And some people just say, "Oh my gosh, I feel like I just went on a 2-week vacation." It feels relaxing. It's peaceful.
And there's another thing you wouldn't know was out or wrong or misaligned or however you describe that way of it not being optimal. How would we
Yeah.
know that about ourselves? How would we know to connect some symptoms with our cranium not being aligned properly?
It can be a feeling of tension, the jaw not feeling right, um, tension behind the eyes, headaches. I had somebody that came who had a vaccination, and although it had been fine for many people, she immediately got symptoms of like tinnitus and loud ringing in her ears. And when she came, I worked on that. She said that was the most relief she had had. Periodically, it would come back, but over time, it just got better and better. It's an osteopathic technique, and people go to medical school and focus on different things. They could be a surgeon or a gastroenterologist, but some people end up studying alignment and the cranial system. And that's been passed on to other people. A lot of times, if I were to go to a cranial sacral seminar, I might see physical therapists there and acupuncturists, other kinds of practitioners, massage therapists. It's something that's now gained so much traction that there are a lot of people who do it.
Sounds like you could even end up with that misaligned from having some dental work done, or maybe even a dental examination. Just
Yes.
stare with that mouth wide open for a while and having somebody, cleaning your teeth or whatever, you could get out of alignment. And
Yeah. Or even, people get their hair done, they've got their head in the sink, and it puts a lot of pressure on that cranium. So I always tell people, make sure they put a lot of towels down, when you're going to the beauty salon. So yeah, it's a lot of things that we can do.
has your own life and your own experiences led you along this path? I mean, have there been ways that you've found to heal things in yourself, and then that's taken you down a path? I'm not saying that very well, but I know what I mean. Do you know what I mean?
I do, and it is true. The first time I ever experienced it, I was in college, and I had a horrible headache and 3 tests the next day. And my dorm mate had a professor come by that actually taught sociology, but he also put a little segment in about body work. And this is, of course, going back into the 70s when there was a lot of exploration. And he looked at me and said, "Are you okay?" And I said, "No, I've got a really bad headache." And he said, "Well, here, turn and stand here looking at the wall." And he actually worked on my shoulders and my neck. And within 4 minutes, my headache was gone. I just said, "What did you do?" And he said, "It was just massage." Shortly thereafter, I got really interested in it just opened the door for me. I think it led me to studying massage and deep body work and the emotional connection to the body. And from there, I thought, if I just had a little more knowledge, I could really make changes for people. And then I ended up in chiropractic college. And then from there, I studied craniosacral. It's been so much fun. It just opened a door, and so much is possible.
Love that, because it is fun. It's like you're on a journey of discovery. I have a friend who, she was in college, and she was going in one direction, but she had, as a young child, she'd fallen off a horse and had a problem that never went away, a certain kind of pain that never went away from then on. She was about 6 years old when that happened.
Mm-hmm.
So here she is in college, and somebody asked her something, and she said, "Yeah, I've always had this pain." And this person was studying something very different from her and adjusted her. And it fixed everything and took her off that path and into chiropractic, which really changed her life. She wasn't planning on doing that at all. And that kind of healing can revolutionize our whole life on so many levels.
That's wonderful. Yeah, it is true. And I also had a car accident, and that led me to be curious. And just continuing on nutrition, well-being is so multifaceted. You could never learn enough.
Yeah. It's like having a smorgasbord in front of you and getting to choose and choose and choose different flavors, different textures, and yet they all blend together. If people who are practicing those various things are open, they all do blend together beautifully.
Yeah.
They're not like they invalidate one another, they enhance one another.
Yeah, and working together with other practitioners, it's a wonderful thing to be able to. I often send people out to various things, and they've said, you're one of the few people that actually will refer me. And I go, well, I'm working with others and with you. So I want your well-being. That's number one.
Yeah, I guess sometimes people are afraid of losing that client to someone else in some other specialty. But if the person's well-being comes first, then those doors have to be open. So we're kind of running out of time. I want to ask you if you could just sort of list some of the things that viewers or listeners might not have considered prior to this conversation that might be really valuable to explore. If they're having this, they might want to look into this, that sort of thing. Can you do that?
I actually did write a list of
Oh,
things,
good.
and I'll just kind of read to you because I really wanted to think about what is out there that people may not know. Um, so obviously we have a big need for the medical profession. Today we're able to not live in wheelchairs, but get knee replacements and hip replacements and shoulder replacements. I mean, these are things that change someone's life forever and give them their youth back. All around that are things that build a great life. To me, functional medicine allows people to heal before things are at the point where they have to maybe lose, the vitality of their organs. So seeing things early on, acupuncturists are great. They're doing, functional medicine with Chinese herbs. And I was thinking too about the emotional release techniques, where people can hold an emotion in their body, and that creates kind of a limited amount of vitality there. Myofascial work is where now they're starting to understand how muscles glide and work over the joints, and you can release patterns of tension. Visceral manipulation goes into the organs and works to restore there's a rhythm with every organ, and they work together. Sometimes people have an injury, an accident, or a surgery, or a baby, all these things. And there are people doing great work on restoring the organs. Functional nutrition. Oftentimes I see people that are deficient in vitamin D or B12, and that can affect bone density, the function of their brain, their nerves, peripheral neuropathy. So I love that there's functional nutrition out there and people that are so smart doing that. Meditation, that is another restorative healing modality that people can learn and use themselves and get their sense of well-being. And of course, I mentioned, craniosacral, chiropractic, massage. It's endless what's out there.
It occurs to me too that when people are meditating, when they're having that quiet time, they allow themselves to open to answers coming. It's like the question that I very clumsily just asked you, but you had the answer. Sometimes it's really hard to know what the question is. And when we can hold still, quiet down, that question can get right in there and talk to us and lead us to the next place that we need to go, the next person we need to see, whatever. So that's kind of the magic that comes from quieting down, which is harder and harder to do in this world. People are so used to having some kind of input going on all the time, whether it's a cell phone or a computer or just something that's stimulating all the time. We need that quiet time to get back to ourselves and to hear what life is trying to tell us and teach us. My editorial.
I love that.
Really important because it's becoming so rare. And the more we do all that, participate in all that being stimulated, the more we seem to need it. so that it becomes harder to back off and get quiet again. So meditation, anything that gets us quiet and still and open, can be a first step to what needs to be healed. Soffhea, thank you so much for being my guest today and for bringing this really expanded perspective to our health and well-being. I just love the idea that there are mysteries that can be solved. And as you said, the muscle testing can be so revealing in the hands of someone who's very good at it. It can really help you find your path to wholeness and health. And as we get older, sometimes that's a lot more of a challenge than it was when we were very young and bounced around in ways we don't do so much anymore. So thank you so much for talking to all of us and sharing some of your expertise and your wisdom and your experience with us.
Thank you, Robin. I really enjoyed it. It was fun, and I love sharing all this great. It is magical. I loved your word. There is so much magic out there, and it's real, and it makes life, more fun, and we get to have really good years ahead of us.
Yeah, so important. Thank you all for joining us today, and we will see you next time. Great news, everybody. Our premier hair care product line, Sensationally Silver, is now available on Amazon. You can order it so easily, you can get it so quickly, and you can be so sensationally silver.
Sensationally silver, because you are.